Assalamualaikum everyone. Our next topic of discussion is hyperaldosteronism, means there will be increased level of aldosterone. We know that aldosterone is a hormone that is secreted by the adrenal glands. It causes sodium and water retention and potassium and hydrogen excretion. It is the increased secretion of aldosterone from the adrenal glands. Clinical features include जब sodium water की retention होगी, there will be hypertension. पोटाशियम और हाइड्रोजन आयन की एक्सक्रीशन होगी, देयर विल बी hypokalemia and metabolic alkalosis. Now there are two types, primary and secondary. If there is direct problem with the adrenal glands, it is known as primary hyperaldosteronism, or it is also known as Cone syndrome. There may be adenoma of the adrenal gland or bilateral hyperplasia of the adrenal gland, familial hyperaldosteronism, or adrenal carcinoma. Now there will be increased level of aldosterone produced by the adrenal glands, but the level of renin will be low. If we see the mechanism involved, we know that there are juxtaglomerular cells in the kidneys that sense the low blood pressure in the kidneys in the afferent arterioles. When they sense decrease in blood pressure in afferent arterioles, they secrete a hormone known as renin. Renin hormones converts angiotensinogen, that is a protein secreted by liver, and converts it into angiotensin 1. Then angiotensin 1 is converted into angiotensin 2 with the help of angiotensin converting enzyme that is secreted by the lungs. Then angiotensin 2 acts on the adrenal glands and it causes the release of aldosterone. Aldosterone then causes the sodium absorption and potassium secretion from the distal convoluted tubules, and it causes the hydrogen secretion from the collecting ducts. So due to sodium absorption, water will also follow sodium and there will be hypertension. Sodium potassium excretion, there will be hypokalemia, and hydrogen secretion, there will be metabolic alkalosis. Now the difference between primary and secondary is that adrenal glands are the main cause for producing the increased level of aldosterone. There is no problem with the renin. Adrenal glands are causing increased level of aldosterone. In primary hyperaldosteronism, there will be increased level of aldosterone, but renin secretion will be suppressed by increased level of blood pressure that is entering the kidneys. Because aldosterone is causing increase in blood pressure due to sodium resorption, and renin is suppressed by increase in blood pressure. We know that renin is secreted when there is low blood pressure, so level of renin will be low in primary hyperaldosteronism. So it leads to treatment resistant hypertension. If we see a patient which is not responding to any of the antihypertensive drugs, we can do investigations for primary hyperaldosteronism. Now there comes the secondary hyperaldosteronism. It is seen in the patients with renovascular hypertension, the juxtaglomerular cell tumor, renin producing, and edema. It means that the primary problem is not with the adrenal glands. The primary problem is the renin. For example, renin is level is increased. Renin is stimulating the adrenal glands to produce more aldosterone. So both renin level and aldosterone level will be high. Now, serum renin level will be high. BP in kidneys, causes of increased level of renin are when there will be renal artery stenosis or renal artery obstruction, or there will be heart failure. Means that BP in the kidneys will be low as compared to the BP in the kidneys. Then there will be increased level of renin and it will cause increased level in aldosterone. So the main difference between primary and secondary is that in primary there was in decreased level of renin, and in secondary there is increased level of renin. In primary, the main problem was with adrenal glands that was causing increased level of aldosterone, and in secondary the main problem is that renin is stimulating increased level of aldosterone. Now there is another difference between primary and secondary, that in primary aldosteronism, there it does not cause directly edema due to aldosterone escape mechanism, while in secondary hyperaldosteronism, due to impairment of the aldosterone escape mechanism, there is worsening of edema. Now, there is an important concept of aldosterone escape mechanism, which means that it is a mechanism through which body tries to deal with excess of mineralocorticoids, means aldosterone. Body is trying to escape from the excess effects of aldosterone. What happens is that when there is increased level of aldosterone due to hyperaldosteronism, there is increased level of aldosterone, so there will be sodium retention, increased level of sodium, water follows the sodium, so there will be increased extracellular fluid, there will be increase in extracellular fluid. BP is increased. When it increase beyond a limit, body adopts a mechanism to deal with excess BP, so there will be increase of the ANP. There is release of AMP from the right atria, because right atria sense the increase in blood pressure, and it causes the release of natriuretic peptide. So when there is a release of ANP, it inhibits the sodium intake from the tubules. So there will be sodium excretion, which is known as natriuresis. ANP causes natriuresis. Water follows the sodium despite increased level of aldosterone. So there will be decreased level of extracellular fluid, and there will be no edema. Means it does not directly cause edema in cases of the primary hyperaldosteronism, while in cases of secondary hyperaldosteronism, the causes were heart failure, nephrotic syndrome, cirrhosis. In these causes, there is activation of RAS, renal angiotensin aldosterone system. There is very increased level of aldosterone, so it becomes very difficult to escape from the aldosterone. Means there it is very difficult to prevent the aldosterone escape mechanism, so it causes the worsening of edema. So that was all about hyperaldosteronism.